Well, this week here on Midday, we've heard from a medical expert, a breast cancer survivor, and a woman who is still in treatment for breast cancer. 3 people with one message. Get your annual mammograms and do your monthly self-exams. I found the lump in my left breast doing a self-exam in the shower, and I'm not alone. Listen to this excerpt from a story that I did in July of 2011, 1 month after I was diagnosed.
Early diagnosis improves your chance of surviving breast cancer. So every year, millions of women faithfully follow doctors' orders and get a mammogram. But half of all women have dense or fibrous breast tissue, and mammograms don't always catch the cancer.
A lot of women, unfortunately, don't know they even have dense breast tissue and don't realize that the mammogram is not 100%.
Dr. Ruby Mariotti is a radiologist at the Center for Breast Care at St. Luke's Health System. Cancer in a woman with fatty tissue is much easier to see, but in women with moderate and extremely dense breast tissue, it's more difficult.
Unfortunately, that sensitivity drops to, some studies say, as low as 60% in women with very dense breast tissue.
Pretty shocking. That means that mammograms miss 40%, almost half of breast cancers. But technology is improving the odds. And joining me now is St. Luke's radiologist and my radiologist, Dr. Ruby Mariotti. And this is pretty incredible that mammograms are missing some of the cancers.
It is. Unfortunately, women who have that very dense breast tissue, those cancers can hide in that tissue and we can miss them.
One of the questions that I got when I did this originally was, what is dense tissue? How do you know if you have dense tissue? What is that?
Really, so dense tissue just means that you don't have a lot of fat in your breasts, and that can be genetic. It can just be related to just your overall weight. And really the only way to know is to get a mammogram.
So you'll feel a lot of bumps around in your breast as you do your self-exam that are just benign. They're nothing there really.
Correct.
Okay.
Right.
All right, so technology is changing things though, and it's improving, and the chances are getting better of this mammography improving.
Exactly. So we now have the 3D mammogram, also called breast tomosynthesis, which is one of the latest approved technologies for early breast cancer detection. Unlike the traditional 2D mammogram, multiple images are obtained through the breast to create essentially a 3-dimensional picture. So fine details are more clearly seen and less obscured by overlapping tissue. And studies show we're catching 40% more breast cancers with this new technology.
So things are way better than they used to be.
They're getting to that 100%. We're not there yet.
But a lot of women really still have not heard about this 3D imaging. Who is it for? I know I'm getting it always from now on because I have scar tissue now, especially, so it's good for that.
And you have that dense tissue as well.
Yeah.
Actually, the studies show that all women benefit from the 3D mammogram. So whether you're at high risk for developing breast cancer, average risk, whether you have the fatty replaced breast tissue or the dense breast tissue, all women should get the 3D mammogram.
And all right, we want to always here on Midday include the conversation with our audience. So we have a viewer call today with a question. Surveyor Willis is on the line with us. And what's your question for Dr. Mariotti?
My question is that the doctor is saying that you shouldn't get a mammogram until you're 40. So there's a lot of 20-year-olds or under 40 is having breast cancer. So my question is, do you think they should go ahead and start before age 40?
You know, that's so true. A lot of younger women in their 20s and 30s.
7% of all breast cancers are diagnosed in women under the age of 40, so women in their 30s, women in their 20s. Currently, the American Cancer Society recommends screening mammograms at age 40 and older. They recommend self-breast exams, though, starting around age 20, and they should have clinical breast exams by their doctor at least once every 3 years. Now, if those patients have a family history of breast cancer, especially at a young age, they should talk to their doctor about getting earlier mammograms.
Okay, now let's talk about cost, because it did cost me an extra $40 over what insurance paid. So, but you believe it's well worth it.
I do. So there are really 2 downsides to the 3D mammogram. One is there is an additional cost, and at St. Luke's we charge $45. technology is so new, no billing code is in place. So we'll continue to work closely with insurance companies, and hopefully that fee will change in the future. Really, the other downside is there is more radiation with the 3D mammogram in comparison to the 2D mammogram, but that amount is still well within the recommended guidelines.
Thank you so much for being here, and thanks to Surveyor Willis for that question as well. It's a good discussion, and definitely talk with your doctor if you have many more questions. Now, tomorrow is, of course, the final topic on our week-long look at breast cancer, and the topic is caregivers. So, again, be part of the conversation. Send us your questions on Facebook, and we'll have Carla Nichols with Cancer Action, and we'll also have a surprise guest. A man is coming here to the studio. All right, stay tuned for that tomorrow.